Hello, my name is Dr. Jonathan Cole, and I'm the medical director here at the California Health and Longevity Institute. I'm here to talk to you about something that is affecting our community right now, and that is measles. Interestingly enough, measles was something that in the year 2000, our government, including the CDC, said that we had eliminated from this country. However, based on a number of outbreaks in the last couple of years, specifically one in the Amish community in 2014, which caused about 350 new cases of measles, and one that was spread from Disneyland in this year, which amounted for nearly 30 to 40 cases of measles. It is put back on the front burner, and it's something we need to address for community health. Now, what is measles? Measles is a virus, and it is spread through coughing and sneezing. In fact, measles is so contagious that with one sneeze or cough can infect 9 out of 10 individuals in close proximity. So because of that level of contagiousness, it's very important to act on this and look at ways to prevent this disease. So what are the signs and symptoms of measles? Initially, we look for the 3 C's: cough, coryza, and conjunctivitis. What do those terms mean? Cough, definitely. Coryza is a runny nose, and conjunctivitis is very red, watery eyes. Typically, the rash starts about 3 to 5 days following the onset of symptoms. Associated with these symptoms is also very high fever, up to 104, 105 degrees Fahrenheit. So it can be a very serious disease, and in fact, not infrequently, people will need to be hospitalized if they get this disease. In addition, measles can cause a number of significant health issues, including brain damage and even death. So what can we do for it if someone gets the measles? Unfortunately, all we can offer once someone has the disease is supportive care, meaning cough suppressants, IV hydration if they need it, medicines to lower their temperature, anything to make them more comfortable. The key is in prevention. And in fact, we have an incredible way to prevent measles, and that is with the measles vaccine. The MMR vaccine stands for measles, mumps, and rubella. Now, the vaccine is very protective, and in fact, after the recommended 2 doses of vaccine, a patient will have over 97% protection from measles. It's not 100%, but it's pretty darn close. And in fact, as I said earlier, with our mass vaccination practices, and it is a very safe vaccine, we had eradicated measles from the United States as of the year 2000. What has caused it to come back is that measles still exists abroad, in Europe, in Asia, in Africa, in India. They still are battling with measles. And therefore, when we have people who travel to America or move to America who develop symptoms, they can potentially spread it. In addition, there is a certain groundswell of areas of unvaccinated patients in and around Los Angeles and other metropolitan areas, which again does promote the spread of measles. So my recommendation is to absolutely get vaccinated. Now, as an adult, the question is, should an adult get a booster shot? I personally have checked since this recent outbreak a number of patients for immunity to both measles and mumps, and interestingly have found nearly a dozen of my patients not immune. And these were patients who had been vaccinated. So what I would tell you is that our immunity can wane as we age, and therefore it's very easy to check with a simple blood test to see if you are immune and to see if you need a booster shot. So the lesson here is get vaccinated. We can again eradicate this disease, which can be deadly, from America, if not the world, by just promoting vaccination. If you want any further information on the measles, I would highly recommend going to the CDC website, which is www.cdc.gov. Thank you very much.